Good evening, everyone. I'm Dr. Prasanna. Today's topic of discussion is herpes in pregnancy. So we all know that a pregnant lady, if it is getting affected with if she's getting affected with the herpes, then there is good amount of rate of infection to the neonate. Okay, so neonate also have that kind of symptoms like skin lesions, eye, conjunctiva being affected, even oral ulcers being seen in case of neonates. And same thing, the neonates can land up in CNS infections with herpes. Okay, so we all know that herpes is a DNA virus, right? So that thing, that very happy DNA virus. Okay, it's a double-stranded DNA virus. So herpes infection, if occurred in first time in life, that is known as primary herpes. And if the infection is recurring so many times, she already had a past history of herpes. Again in pregnancy, she's getting herpes infection. Then it is known as recurrent herpes. Okay, so what happens is once the pregnant lady being affected with herpes, then there is a very risk of chance of getting into the baby almost 41%. How much? Almost 41% chance of baby being affected. Okay, so that's why we should be very cautious while treating the herpes in pregnancy, a pregnant woman. Okay, so basically, the 41% of risk of infant getting affected, and second thing is what are the different symptoms being seen? One is skin infection, and you have eye infection, eye lesions. Then you have mouth lesions, okay? Even mouth lesions are seen, okay? These particular lesions, which are on skin, on eyes, and mouth, are seen in case of 30% of cases. It is in case of 30% of cases. There can be local CNS infection. There can be local CNS infection in case of 60% of cases, in case of 60% of cases, and there will be diffuse CNS infection, CNS infection in case of 70% of the cases, in case of 70% of the cases, okay? These are numbers we should remember. So basically, I told that neonates get affected by means of 41%. And if a lady came, for example, think this is a lady, pregnant lady, and she came and she's saying that, see, sir, I have herpes. This is the first time I had herpes in my life. But even though she's saying that she's having first time in herpes, she might not remember that. She might not remember that, and she might have recurrent herpes of 15%. Recurrent herpes of 15% chance. Okay. Now coming to what is a primary herpes? If her primary herpes is has already came, what should we do? If there is recurrent herpes, what should we do? We'll come to that case. Okay. So first thing, if a lady came with a primary herpes, okay, if a lady came, a pregnant lady, she came and she's saying that I'm having primary herpes. This is the first time I've had these lesions. Then you say, what is the months of pregnancy? What is the weeks of gestation? Whether she is 28 weeks above or whether she is 28 weeks below. Okay, that is the thing. So if she is more than 28 weeks, that means she is very near to delivery, right? If she is more than 28 weeks, she is very near to delivery. So if she's less than 28 weeks, there is some time to develop antibodies. So if she's more than 28 weeks or within 6 weeks of expected date of delivery, if she's having this primary herpes, then this person, we will give acyclovir. We will do what? We will give acyclovir, right? We will give acyclovir and we'll plan delivery. We will plan delivery at 36 weeks by means of cesarean. By means of cesarean. Okay, that is very important. Why? Because there is no risk of neonatal infection. Okay, if she's less than 28 weeks, then also we'll give acyclovir. Then also we'll give acyclovir, and at 36 weeks again we'll give acyclovir. Okay, now we'll give acyclovir for 5 days. Again at 36 weeks we'll give acyclovir till delivery. But this kind of persons we can plan vaginal delivery. Understood? So thing is very simple funda. If she's having primary herpes, if she's more than 28 weeks, first thing, if she's saying that I am more than 28 weeks, then I am more than 7 months, I am 8 months pregnant, then you will see, and she's within 6 weeks of delivery, right? 8 month pregnancy, within 6 weeks of delivery, she had this primary herpes lesions. So this particular lady, we should give acyclovir and we'll plan delivery as cesarean section. If this lady is saying that I am 6 months pregnant, okay, I am 6 months pregnant, then you'll give acyclovir for 5 days. Then at 36 weeks also will give acyclovir for till delivery, and you can plan delivery by vaginal delivery. You can plan delivery by vaginal delivery. That's about primary herpes. Okay. Coming to recurrent herpes is very small type of it is simple type, kind of herpes. It's not a big thing because babies getting affected is only 0.0 to 3% chance. There is only 0 to 3% chance. It is very low chance that babies can get affected. Okay, if there is recurrent herpes, also we can plan delivery. We can plan delivery, and will even in recurrent herpes, fur lesions will give acyclovir. Fur lesions will give acyclovir. Okay, so basically, acyclovir will give, and that too also at 36 weeks. Okay, for recurrent herpes at 36 weeks till delivery will give. So I'm telling you, acyclovir will give acyclovir. What is a dose in herpes? Acyclovir dose is 435. 435. Okay, that is 400 milligrams. 400 milligrams thrice daily for 5 days. 400 milligrams thrice daily for 5 days. You'll give that. Okay, so if in case of chickenpox, remember chickenpox? Okay, chickenpox will give 857, right? 800 milligrams 5 times daily for 7 days. Whereas herpes H, it is 435. Okay, that's about recurrent herpes. Now, we learn about what is a primary herpes. I told you what is the easy way to give, and I told that primary herpes, we will do cesarean section. You will do cesarean section. If this lady is saying, you said that you are 8 months pregnant, no, better you go for acyclovir and go for cesarean section. When she came in labor, na, she's saying, I don't want cesarean section. I want vaginal delivery only. I want vaginal delivery. Then for this kind of lady, you'll give acyclovir. You'll give acyclovir that to almost 5 milligram per kg body weight. If she's 50, then 250 milligram of acyclovir IV you'll give. Okay, this you'll repeat every 8 hours. 8 hours. Even the baby mother, you'll give this one 5 milligram per kg body weight. After delivery, the baby you should give 20 milligram per kg body weight. Okay, that much risk is there. So if this lady, better go for cesarean. But if this lady says, no, I don't want cesarean, I want only vaginal delivery, then for this lady, you say, you will say that I will give acyclovir 5 milligram per kg body weight, and for the baby, you will give 20 milligram per kg body weight. Right? Now, if there is a, this is about primary herpes with who is rejecting. Okay. Now, if a lady came, this lady came, she's having primary lesions, first time lesions she had. Now we'll ask the weeks of gestation. If she's more than 28 weeks or more within 6 weeks of the delivery date, then you will give acyclovir and you'd plan mode of delivery is cesarean section because there is no time for antibody formation. If this lady came with primary herpes lesion and her weeks of gestation is less than 28 weeks, and for this kind of lady, you will give acyclovir. What is the dose? 435. 400 milligrams thrice daily for 5 days. You'll give that for 5 days and you'll stop. At 36 weeks, again, you'll give 435. Not for 5 days, you'll give till delivery. That's about primary herpes of less than 28 weeks. If and this particular lady is there, na, less than 28 weeks, we can plan vaginal delivery for her. Okay. If she's recurrent herpes, she said that I have these lesions. Always in the past, also I used to have these lesions, and that kind of lady, you will just treat the symptoms. You will try just treat the symptoms, and along with symptoms, you will also give cyclovir. That is 430 delivery. Okay, 400 milligrams thrice daily till delivery. And that too, I will start this 4-3 delivery dose at 36 weeks of gestation. That's about recurrent herpes. Okay, so uh, if a lady came, I'll take another lady. This is another lady. Okay, this lady came, and this lady is saying that I am down. My pregnancy is 37 completed weeks. Now I'm having leaking per vaginal. So you saw her. There are so many lesions on the oral, on the eyes, and conjunctiva is very red. You're suspecting herpes. Okay. So this particular lady is from, okay, pre-labor rupture of membrane, 37 completed weeks, and she's having from. In this condition, what shall we do? See, already membrane is ruptured. So as there is membranes of rupture and she's having primary herpes, then you'll go for cesarean. Before going to cesarean, give acyclovir. Okay. So this particular lady, term pregnancy you'll give acyclovir and go for cesarean. If she said that, no, no, these lesions are very common. I used to get so many times in my childhood and recently also, okay, I got this herpes. Okay, for this kind of recurrent herpes patient, what you'll do, she's having lesions, she's having prom, so you'll give acyclovir and you'll go for immediate induction of labor. Why? As there is rupture of membranes, it is leaking. So there is, I already told, there is 41% chance that the baby can get affected. So to avoid that, you'll go for induction of labor and go for vaginal delivery. That's about prom. There is one more lady there is one more lady. So this is a lady. Okay. This lady came. This lady came and she's saying that I am 32 weeks, but I'm having leaking. And she's also having total ulcers and eyes are very, very red. So she's pre-prom. She's pre-prom. So for this pre-prom patient, you see, we'll ask history. Then she's saying that no, 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 I got this is the first time I got. She's primary herpes. As there is primary herpes, you try to treat her. You'll give acyclovir, and if she's getting treated for 5 days, IV acyclovir and all, based on severity. And if she's getting treated, then you'll go for conservative management, and you'll involve all the multidisciplinary team. You'll involve the physician, you'll involve the dermatologist, you'll involve these um, uh, communicable disease team people, and you'll involve them, and you'll try to maintain the conservative management of this patient so that this lady crosses 34 weeks. Okay, and you'll give steroids for lung maturity of the baby. So after she crosses 34 weeks, you can plan vaginal delivery. You can plan delivery. And this kind of patient, as she's having primary herpes with prom, you'll prefer cesarean section. If there is pre-prom with recurrent herpes, then you will try to manage conservatively by steroids and all. Then you can plan vaginal delivery. So basically, fundamental concept is if you have primary herpes, if you have primary herpes, then you go for cesarean section. If you have recurrent herpes, then you plan for vaginal delivery. If she's having primary herpes and she's having less than 28 weeks of gestation and she can maintain the pregnancy, then you will give this acyclovir. After the treatment, you can plan vaginal delivery. Okay, that is the only exception to the primary herpes. Now, I'll give some scenarios. Before proceeding into scenarios, let's see the algorithm. Okay, let's see the algorithm. Okay. So if you see, this is the management of herpes in pregnancy and the care of neonate, right? Hmm. So if you see properly, if there is, first thing is if there is recurrent genital herpes. If there is recurrent genital herpes, then you'll treat the recurrent lesions by means of standard dose. What is the standard dose which I already told? 435. 400 milligrams thrice daily for 5 days. Okay, you will treat that. Okay, that is the what? That too. See, recurrent herpes, you'll give till delivery, right? You'll 435 till delivery. You'll give. Okay, from 36 weeks. Coming to second scenario, I'll complete this. So recurrent herpes, you'll give acyclovir till delivery, and you'll plan delivery as vaginal delivery, and normal postnatal care will do. And you will inspect the genital lesions for any genital lesions at the time of delivery. Okay, that's about recurrent. If there is any primary acquisition in the first or second trimester, I don't know, it is less than 28 weeks. If this is less than 28 weeks, just close your eyes. If there is less than 28 weeks and just having primary herpes, what you'll do? You'll give 435 now for 5 days. Then you'll give again 4-3 delivery. Okay, at 36 weeks of gestation. Okay, so same thing. You'll treat the primary episode with standard dose. You'll treat the primary episode with standard dose. See, even in recurrent genital herpes also, you'll give a standard dose. You'll give a standard dose. Then again at 36 weeks, you'll give that 4-3 delivery. Okay, as she is less than 28 weeks, you can try the vaginal delivery. I told you, only exception for primary herpes is if the lady is less than 28 weeks, then you can try vaginal delivery. If she's more than 28 weeks, like third trimester, if she's getting primary herpes, then you'll give the standard dose and also consider this dose till delivery. Okay. You'll inform the neonatologist and all. And see, if mostly you should plan cesarean section. If she wants only vaginal delivery, then you'll inform the neonatologist also. And you'll start what? Acyclovir. What is the dose I told? Acyclovir, 5 milligram per kg body weight for the mother. And for the baby, what is the dose? 20 milligram per kg body weight. Okay? Yes, Angel. And baby should be inspected for at least 24 hours. You will see any conjunctivitis, any oral ulcers, and any lethargy, drowsiness, less feeding, irritability in the baby. You inspect that in case of in 24 hours. Okay? If baby is well, if baby is unwell. Okay? So if baby is unwell, then you'll do lumbar puncture. If baby is well, then you will start the acyclovir, which I already told, 20 milligram per kg body weight, and that too for 10 days you'll do. Okay, that's it. That's it about the lesion. So I just repeat again. If there is the recurrent genital herpes, you will treat with the standard dose. If there is primary herpes with less than 28 weeks, and also you will treat the standard dose. And at 36 weeks, you'll give the standard dose till delivery. In case of more than 28 weeks, then you'll give the standard dose and you'll plan delivery by means of cesarean section. If she wants only vaginal delivery, then you'll give the acyclovir IV. Okay. Now let's do some scenarios so that we'll know. Okay. So first scenario is a priming, a priming, and uh, uh, a lady, pregnant lady. She is less than 28 weeks. She is less than 28 weeks, and she got primary herpes. Primary herpes. She got what? Primary herpes. Okay. What should we do? If she have primary herpes, what should we do? And I told she's less than 28 weeks. Okay. If she's less than 28 weeks, just guess it. If she's less than 28 weeks, primary herpes, then you go for yes, 435, and at 36 weeks, we'll again give 4-3 delivery dose. Okay. And you plan delivery by means of vaginal delivery. Okay. And in this case, you should always involve multidisciplinary team. Then, second scenario. There is a pregnant lady with primary herpes and she is more than 28 weeks. If she is more than 28 weeks, what will do? She is more than 28 weeks, you will do 40 delivery dose and you will cesarean section. Okay. Then, if she is having a pregnant lady, she is having herpes, recurrent herpes. Okay, and she is less than 28 weeks. She is less than 28 weeks. What should do? Recurrent herpes means if the lesions, you'll treat the treatment, you'll treat the symptoms. You'll just treat the symptoms. But you'll give acyclovir only at 36 weeks, up to 4-3 delivery dose. Right? Next scenario, uh, pregnant with pre-prom. Pre-prom means already she is less than 34 weeks. Less than 34 weeks. Right? And she's having primary herpes. She's having primary herpes. What should we do? As she's having pre-prom, first thing you will involve the multidisciplinary team. You'll give steroids, you'll do conservative management. Yeah, at least after 34 weeks, you'll go for delivery. That too, LSCS. Okay? That thing. If there is recurrent herpes with pre-prom, same thing. If there is recurrent herpes with pre-prom, what shall we do? These are the same thing. You will give steroids. As this pre-prom, you should always give erythromycin. You should always give erythromycin. Okay? That. Now, baby being delivered now. This baby being delivered by means of cesarean or vaginal delivery in case of primary herpes and all. You'll inspect all the lesions. And first thing is in case of um, recurrent herpes, you can plan vaginal delivery. In case of primary herpes, you will plan cesarean section. So in these conditions, in these two conditions, in these two conditions, the baby is safe. Okay, the baby is safe. Well, if there is primary herpes and she went vaginal delivery, okay, and if she, this is a critical situation. If primary herpes with vaginal delivery, it's a critical situation. So in this, you'll see the baby. A baby also you'll inspect, you'll take swabs. You'll take swabs from these sides. Spore. What is spore? Skin, conjunctiva, oropharynx, and rectum. Okay, skin, conjunctiva, oropharynx, rectum. In these areas, you'll take swabs and you'll culture for herpes. That is DNA PCR. Okay, if it is positive, then you see whether baby is well or unwell. If the baby is well, is okay. If the baby is unwell, if the baby is unwell, okay, then you will take not only spore samples, you also do lumbar puncture. Okay, lumbar puncture, right? Lumbar puncture. So thing is, spore you'll do in case if baby is well. If baby is unwell, then you'll go for spore as well as lumbar puncture. Okay. If baby had any lesions, then you'll go for IV acyclovir. You'll go for IV acyclovir. And you know the dose is IV acyclovir is 20 milligram per kg body weight. Whereas for the mothers, the IV acyclovir dose is 5 milligram per kg body weight. Both for the baby and also for the mother, you'll give IV acyclovir for you'll give 8 hourly. Okay, you'll give 8 hourly. That's it. So the fundamental concept of this herpes is if there is primary herpes, then you will go for cesarean section. If there is more than 28 weeks or within 6 weeks, she's having primary herpes because there is no time for antibody formation. If it is primary herpes of less than 28 weeks, you can plan vaginal delivery. If there is recurrent herpes, you can say you can plan vaginal delivery. Okay, that's it. Next, I'll discuss about malaria and meet you in next video. Okay, bye.